Okay, I think we'll go ahead and start. It's about 3:35. We might have a few more people join us here in a little bit, but we can go ahead and start now. I'll introduce myself. I'm Kristen Coleman. I am a program specialist at the State Department of Education and the Special Education Office. I do a lot of work with the alternate assessment and deafblind technical assistance project and other things. We all just kind of do a little bit of everything at the State Department. And I will go ahead and have Susan introduce herself.
Yes, hello, I'm Susan Baus, and I am the program specialist in charge of behavior for the State Department of Education and Special Education. And I support all the districts in whatever questions they might have related to behavior.
Okay, and we also have Kristen Perez-Rickles, who is our moderator today. You can introduce yourself.
Hey, I'm Kristen Perez-Rickles. I'm just the moderator today, but normally I'm an MTSS specialist for the State Department of Education. I will just be watching the chat box though.
Okay. And today we have Sarah Sewell with us. She is the Executive Director for Down Syndrome Association of Central Oklahoma, also known as DASCO. The State Department in our office has started doing a webinar series, and we have named it Community Connections. We are wanting to highlight some of our state and local advocacy groups. So we decided to have DASCO kick off our webinar series today. And thank you so much, Sarah, for agreeing to do this with us today. We really appreciate it. And for everyone who joined, please let this be an interactive webinar. Anytime you have a question, feel free to ask. I believe there is a Jamboard that you can ask questions and Sarah can answer them afterwards, or whatever you feel comfortable doing. But I'll go ahead and let Sarah kick us off. Thank you.
Yeah. Thank you guys so much. I'm so honored to be speaking to y'all today. And, you know, as you know, education is one of our main priorities and definitely something we advocate for daily. Just to kind of tell you a little bit about myself, this is me and my daughter, Kirsten. Kirsten's 14. She's in the 8th grade. She attends Noble Public Schools. She's in middle school there, and she, you know, we include her in just about every activity imaginable. She does have Down syndrome. She has trisomy 21. I'll explain a little bit more about some other types of Down syndrome here in a minute. And you know, she's just one of my favorite kids. So I joined the Down Syndrome Association almost 3 years ago. Prior to being the executive director, I was serving on the board of directors as president, where I'd been there for about 6 years. And of course, when Kirsten was born 14 years ago, I kind of just threw myself into the organization and, coordinated their what we call buddy walk or awareness walk for about 6 years prior to that. My job before becoming executive director, I worked at the University of Oklahoma in public affairs and was an associate vice president there, where I managed all the events and media relations and activities under the president's umbrella. So I found my passion here and my love for our kids, and that's why I'm here today. So before I think, we go into further, what we do, I think it's really important to always know, what is Down syndrome. And sometimes there's a lot of misconceptions, but the definition in Webster's is that it's a genetic condition resulting from a third copy of the 21st chromosome. But in our world as parents and advocates, we like to say it's the innate ability to see the good and beauty in the world, to radiate joy and happiness, and to offer a unique perspective on life with the ability to change others' perceptions. And I do believe that's what my daughter does, as well as all the other kids that we serve in this area. So again, just to kind of go through what is Down syndrome, it is an extra copy of the 21st chromosome, resulting in 47 instead of the original 46. Right there to your right, that is a copy of the actual karyotype showing the third copy on the 21st chromosome. It is a genetic disorder on the 21st chromosome. Down syndrome occurs in about 1 in 691 babies. It is the most frequently occurring chromosomal condition that a person can have. And babies that are born with Down syndrome come from all economic levels, races, in every country around the world. We like to say that Down syndrome does not discriminate. In the United States, there's estimated about 400,000 people living with Down syndrome. It's the most common chromosomal abnormality in humans. There are physical growth delays and mild to moderate intellectual disability. There are specific characteristics such as facial features and hands and short stature. There you can identify someone with Down syndrome. Our kids do have more health checks than a regular child and have to see special therapists and do special ed classrooms like you all do with enhancing those speech and fine gross motor skills. But to us, it doesn't matter. We like to see the individual for who they are, and we want them to be treated the same. As some of you know that have worked with individuals with Down syndrome, they have the same likes and dislikes, just like you and I. I have a quick video I'd like to show, and hopefully I can do this real quick without screwing something up. So I'll stop sharing for a second to reshare. Okay, do you see a doctor standing there on the screen? Okay, great.
There'll be a lot of limitations.
Can you hear it okay?
Are you sure about that?
They tend to do well performing only the simplest of tasks.
I am a lobbyist at Capitol Hill.
A regular life with lasting relationships.
We've been together 14 years. A cognitive sailor limits their ability to work. I own a business.
They'll also tend to prevents the impulsive cheap salesforce.
That's just a brief description of, us wanting everyone to see the person for the, not the diagnosis that a lot of our kids are labeled as. And, that's as a parent, that's really kind of hard to swallow sometimes because our kids are always put in a box and we don't always see them as in a box. Okay, can now everybody see my PowerPoint again? Okay, great. Then I did that right. So I have a quick little quiz, and if y'all want to turn your mics on, you can answer out loud. But these are just some, misconceptions that happen when I speak to individuals like, what is Down syndrome? So Down syndrome is a rare genetic disorder, true or false? Nothing rare about it. It's commonly known. And like I mentioned earlier, about 1 in 700 to 800 live births is a child with Down syndrome. And then there's an estimated 350 to 400,000 people living with 5,000 to 6,000 births per year. True or false? Most children with Down syndrome are born to older parents. Get this asked a lot.
False.
That's right. I 31 when I was pregnant with Kirsten. So, we have our children during the childbearing years. They do say that, after the age of 35, a woman doesn't have as many eggs left, but there's no scientific proof to say, oh yeah, you're going to have a child with Down syndrome if you get pregnant at the age of 40. It's just an estimated guess, but there's no research to definitely back it up. So kind of like to throw that out there. Yeah, actual fact, I had a new parent yesterday, and the grandmother came in, and the mother is 16, has a new baby with Down syndrome. 16. True or false? People with Down syndrome have severe cognitive delays. Nope. But we even like to measure people by that. It's typically mild to moderate, and IQ's not an adequate measure of their functional status. People with Down syndrome have great potential if they're just given the right opportunities and resources. All people with Down syndrome will develop Alzheimer's disease. Not all, but there is an estimation that 25%, and that actually is increasing. We don't know why, but Alzheimer's is actually doing a lot of research on the 21st chromosome and that extra copy, because there are some direct correlations between Down syndrome and Alzheimer's disease. And in fact, there's a study that's occurring right now in Denver, Colorado, and several of our families have participated in that study with some blood draws a couple of years ago, just to try to figure out what is going on the 21st chromosome, where our kids are aging and getting dementia as early as age 30. The life expectancy of people with Down syndrome is 30 years.
False.
If you saw the video, no. And actually, Oklahoma had the longest living person with Down syndrome. I believe she was 81 or 82. Her name was Dolly. She did pass away a few years ago, but we have individuals that are living well beyond 60s and beyond, and living, great lives with lots of potential. Down syndrome is hereditary and runs in families. Most cases it's not. In our case, it was just a sporadic chance of events that just happened. However, there is a hereditary account, which is called translocation, and it accounts for about 2 to 3% of the cases. One parent's identified as a carrier of a translocated chromosome. Otherwise, it doesn't run in the families. My children do not have a greater chance of having a child with Down syndrome, nor do my siblings. So in the second child, there's about a 1 in 100 chance. However, there is no research to back that up. It's just how doctors put it together, and in the fact that hold on, somebody might be knocking, in the chance that you could have a child again with Down syndrome, because you may not have as many eggs left in your body. But just to talk a little bit about that. So trisomy 21 occurs prior to conception. So either the egg or the sperm had the extra chromosome. There is another type of Down syndrome called mosaic. Mosaic happens after conception during cell division. So chances that there are every single cell in the body will have that extra chromosome may not. But then again, it's still Down syndrome. We still have the same physical characteristics and all the health implications that come along with it. There is little community support for bringing up a child with Down syndrome. Nope, we have a lot of affiliate organizations across the nation and actually around the world to support individuals with Down syndrome and their families. Children with Down syndrome are placed in segregated special education programs. Gosh, I hope not. That's what we advocate for. Studies have shown that regular academic classrooms really help the individual. We all learn from one another and from our peers. And so we advocate for full inclusion in the classroom for all of our kids. Most people with Down syndrome are institutionalized. No. Today they live at home with their families or in group homes. They are integrated in regular classrooms and are active participants in the community doing various activities and recreational activities. Adults with Down syndrome are unemployable. Again, false. You know, we have businesses that call us regularly wanting to hire adults with Down syndrome. We are currently working with the Oklahoma Restaurant Association, where they are putting together a skill list where individuals can get, with Down syndrome, can get a certificate, and then restaurant or hospitality units will actually hire them once they have this skill list certificate. So they are the most dedicated, hardworking, reliable individuals, and most of them do not like to take off work even when they're sick because they are so dedicated to their job and to their employer. Just to talk a little bit of some of the challenges that our families face, as well as individuals with Down syndrome. You know, adults with Down syndrome experience some accelerated aging. So that means they just have to do regular checkups early on. The Global Foundation for Down syndrome just put out a new medical guideline for individuals with Down syndrome. So instead of getting Alzheimer's checks, you know, for us would be, you know, after the age of 60. For individuals with Down syndrome, we start those at age 30. Women who have Down syndrome, it's recommended they start regular breast exams and mammograms at age 25. So we've just learned a lot about the extra chromosome and the health implications that go along with it, and that those regular health checks need to occur a little bit sooner so we can do some preventative measures. As adults with Down syndrome grow older, they are increased risk to experience certain common mental health disorders like depression, anxiety, and obsessive compulsive disorders. You know, sometimes I think that's related to their lifestyle and the lifestyle change, and, you know, just not having structure or a job or things to look forward to. So we hope to change that here in the near future. Adults with Down syndrome are at an increase of Alzheimer's disease as they grow older, but Alzheimer's disease is not inevitable. And there's other things to help with memory loss. So we just think that if you get those early checks and start preventative measures early, that can help offset a lot of the challenges. This is just a resource link. I'd be happy to share this with you in the chat session of just what adults with Down syndrome and aging and what those regular health checks can be. So some conditions that are associated with Down syndrome: 50% of our kids when they're born have some type of a heart defect. I really think that is higher than what the national statistics are saying, because almost every new parent call that we get, I would say at least 90% of them have some type of heart issue. Vision problems, another 50%, hearing loss, 74%. You know, they're more prone to lots of infections, hypothyroidism, blood disorders, hypotonia, the poor low muscle tone, problems with the upper part of the spine, disrupting sleep patterns or sleep apnea, gum disease, which is also part of the sleep, or the opening of the mouth and keeping the mouth open, sleep apnea, epilepsy, digestive issues, celiac disease is pretty common, and then mental health and emotional issues. So I just wanted to bring this up, and then I'll go into a little bit more about our organization, but I feel it's really important because a lot of times our kids are, you know, not really given an opportunity to communicate, and not knowing how to communicate with them, it can be kind of complicated for you as educators, but these are just some successful communication tips that we found to be helpful. First of all, you know, in getting started, if you're meeting a new child, you know, how you approach them. If it's from the front, if you're from behind, our kids are very relational. So, and they pick up on every single feeling and emotion and sound and expression. So, you know, how you make that first approach is so important. Make sure you're smiling, identify yourself, who you are, what your name is. Remember, our kids are relational. They want to know everything about you. So if you can start off a session and say, I have a puppy and my name is Sarah and I like to play outside with my puppy. If that child likes animals, they're going to be able to relate with you right off the bat. Use their name. I mean, our kids don't know all the time that they know right off the hand that they have Down syndrome. They think they're just like every other kid. And we always use people first language. So we never say, oh, there's the Downs kid, or that kid with Down syndrome. The kid has a name. And if possible, always try to be at eye level and make direct eye contact. Again, our kids really like to relate to you. Very touchy-feely. Facial expressions are so important. Always be friendly and relaxed, and remember to smile and have some humor and, kind of joke around with them, and being patient and supportive. Tone of voice. This is probably one of the most important ways of communication. Remember, our kids have some hearing loss. So if you have a real high-pitched voice and they can't hear those high tones, that's going to be hurtful to their ears. Again, if you have a lower tone voice and they can't hear the lower tones, they're going to have a harder time understanding you. So voice is so important in the communication aspect. So make sure you speak at a kind of a monotone tone. Speak clearly and slowly so they can understand you, but also in a relaxed tone, that it's not anything aggressive, or we can all have a sense of stress in our voice if we are stressed out. So just make sure it's easygoing and conveys a moderate tone that's pleasant. Body language, very important. Sudden movements, being open to relaxed and with your stance, make sure you're calm and confident, to provide reassurance to our kids. Gestures, sometimes our kids are visual learners. If you know sign language and you talk and use sign language at the same time, that's really going to help in their engagement with you as well. And I will add the visual cues. So if there's any types of visual cues that you have to get them engaged, those things help as well. I want to kind of stop there and see if anybody has any questions, because that's a lot of information there. And I know you all probably have experienced a lot of these things. So if you have any stories to share on what did or didn't work, I'd really like to hear those. I guess we'll move on. And then I just always like to focus on, the coordination of care and the team members that surround the person. You always remember that the person is at the core of all of this, and those supports around them, are the team of people that are working with them. And those can be those people who are setting and planning goals, initiating action plans, and, evaluating and progressing with progress, and assessing strengths and challenges. And those can be a variety of people. And then those outside of that, who's going to support those initiatives? Well, you've got family, or if it's a group home or a day center, or maybe it's a healthcare provider or therapist, or maybe it's some community services programs that they're a part of. And most importantly, if they're working individuals, maybe it's employers. But also I've noticed that even employers that support the parents are just as important to the center of this as everything. So just always keeping in mind that, our kids and individuals with Down syndrome are at the core of all this. And for them to be successful, it takes all of these as a team for them to have the supports that they need. So let me tell you a little bit about Kirsten, and then following through with our organization. Like I mentioned earlier, we involve her in absolutely everything possible. When she was born, I knew it was my goal as her mother to make sure she was seen as the person she is for what she likes to do and what she doesn't. And keep in mind, I knew nobody who had Down syndrome. This was just my motherly instincts. But at that point, I knew, I loved her for who she was, and I wanted everybody else to love her the same. And I didn't want to put any limitations on her whatsoever. And, challenging her has probably, it's hard, but it's been the best thing for her. And I realize what some of her limitations are, but that doesn't mean we're not going to still keep pushing forward and pressing forward to try to achieve those goals. She gets to do a lot of fun things. She's met Baker Mayfield. She gets to go to the OU games. She's been on the cheer squad at Noble. You know, we just involve her. I just kind of throw her out there, to be honest.
She's adorable.
Thank you. So Kirsten's really involved in the 4-H program here in the state, and she shows sheep, and she does really well with that. You know, she's very relational when it comes to animals. And I thought, what am I going to do? How can I get her to, you know, progress in her independency and teach her her responsibility? And then I was like, we're going to show some sheep. It's a lot of work for me, but it's really good for her. I want to show you this next video of her. My family, we love to snow ski. And I know when she was born, we were like, what are we going to do? We go snow skiing? Are we going to be able to take her? Because when she was young, she was pretty sick. She had open heart surgery when she was 3 months old. She's had onsets of pneumonia, probably 12, 14 times. I've lost count. Kirsten's had numerous sets of ear tubes. She's had 2 eye surgeries. She's had 2 sinus surgeries. She's had nasal reconstruction. You know, all of hers is kind of upper respiratory above the throat. And of course, you know, going to the mountains isn't always great when you're breathing in cold air. And but she does great. But our families are avid skiers, and we were always told she's not going to be able to ski. She's not going to be able to do all that. Well, let me just show you the video. This is a couple years old. You got to have good muscle strength to do that, by the way. She's giving a thumbs up. She said she wanted to go faster. So that's, she's kind of the daredevil. This next video, you know, we try to, you know, when I have her IEP meetings with her teachers, you know, I always try to mix in a lot of therapies and a lot of different things, just knowing how Kirsten learns. She's very, she's an auditory learner, but she does like tactile things. And so I thought this was really clever in this next video, how her teacher, they're learning to count. And we've added in some fine motor skills in this, as well as some verbal communication along with this. So let me show you her counting. Now when she does something good, she always wants reinforcement. Did I do a good job? I counted, and she's now counting beyond 100 and, you know, starting to put words together to read. So, but that just goes to show you, she needs that, you know, tactile, and, you know, to hit the little object there to count it. And, you know, there's verbal communication going on there. There's some fine motor skills going on there. And then there's the academic learning going on there. So there's all kinds of creative ways, and you all know that, to incorporate learning into our kids' lives. You just have to figure out what those are and how the kids respond to it, you know, making it fun and engaging. So, you know, we like to say that having a child with Down syndrome is like taking a scenic route. You'll eventually get where you're going, but it's going to take you a little bit longer to get there, but it's well worth the trip. And then, of course, you know, none of our families planned this journey, but we have some of the most amazing tour guides. And that's exactly what Kirsten has done for us. I know the definition we talked about earlier, she definitely has changed our family dynamic. She makes us see things through a different lens every day, and amazes us and does new things on a daily basis. And like I said earlier, she's my most favorite human. In Oklahoma, the Down Syndrome Association, we serve about 900 families. It's actually approaching a little closer to 1,000 in the central Oklahoma area. So we serve everything pretty much, in Oklahoma County and beyond, and out in western Oklahoma. So we have families even out in Boise City, Oklahoma, Texoma, Weatherford, Corn, Oklahoma. I mean, they're kind of everywhere. There is an association in Tulsa, and they kind of serve the northeastern part of the state, about 250 to 300 families in that area. And we all work very closely together and share resources and programs and activities. A lot of the children who are born in Oklahoma with Down syndrome, most are born at Children's Hospital. So we always usually get the first referral, but depending on which association they're closest to, we let them choose, do you want to, but of course, everybody's invited to be a part of our activities and programs. Our mission is to raise awareness as well as promote acceptance and inclusion for people, or raise awareness and provide resources as well as promote acceptance and inclusion for people with Down syndrome. And I have one more video to show real quick. So let me stop sharing. And it always starts right in the middle. So try this again. We have about 6,000 people that typically attend our awareness walk.
Yeah, I was saying, it looks huge. love that.
So that's just a little bit about, hold on a minute, I'm gonna get this up. Close so I can get back to my PowerPoint.
And of course, we love Miss Amazing at the State Department.
Yes.
She has not enjoyed working from home.
No.
That's for sure. She has been texting me and saying she is ready to get back in the office.
Yeah, same. She volunteers with us, pretty regularly, as much as we can let her around here without, hoping there's no exposure, but
Right. She likes to keep busy.
5 texts from her today.
She likes to keep busy.
She likes to stay busy, and we do keep her pretty busy.
Good.
So one of the first programs that we do here at the organization is we offer our first connection. So any new parent that joins the organization is partnered with a mentor parent, typically one that has around the same age, or not necessarily the same age, but live in the same location as that family. We provide them with a new parent bag that has books and resources and probably too much information for a new parent all of a sudden it wants to get into. But, I try to knock that down whenever I meet with them individually and just say, hey, here, first thing, go apply for Social Security, get on Sooner Start, and make sure you're getting your regular health screening. So that's really kind of where we start with the basics. And then slowly, we reach out, okay, where are you at today and how is the baby's health? Because a lot of our new families aren't just quite ready for that first call. We don't reach out until they're ready or they call us first. So that's real important because it's, not something I've been down that road. So I know this isn't something we can just dive in like, oh, it's great, because in the beginning it's not great. You're in shock. You're still trying to absorb what Down syndrome means, and you're scared to death that your child is not going to live. And so I know how that feels. And a lot of them are in the NICU for, extended period of time. And so we let our families reach out when they're ready, and we serve them, if they get a prenatal diagnosis, we'll start those conversations that early if they're ready. Otherwise, we just wait for the phone call. I will tell you, since January of this year, we've had 21 babies.
Wow.
So I don't know why, but that's not normal for us. But in since I've been here, we've had about 150 new families join us. So some of those are new babies. Some are just moving into the state in a variety of different ages. So we do new parent breakfast quarterly, where we provide our families the opportunity to communal together and just ask questions and get to know each other, because you're going to be raising your children along with these same individuals. So we want to establish those relationships early on, and let the kids get to know one another, because more than likely there's going to be a lot of play dates and sleepovers from these new connections that happen. We just had one a couple of weeks ago. So we do quite a few social opportunities. Again, remember, our kids are relational, so they like contact. In the fall, we usually have a Halloween party for our teen and adults. In the spring, we have a Valentine's dance for them. They all love to dance, and we've had many proposals that have happened at our Valentine's dances. Fun for them to, socialize, to be together, and they bring other friends as well. We invite siblings, parents, whomever wants to come. We also have an Easter extravaganza, or just a big Easter egg hunt for all ages, and do kind of a cookout. And we try to do what we call mommy mingles, or play dates here at the office, and we bring in therapy dogs, or we might bring in somebody to help with sign language activities to teach our new parents sign language. And then prior to COVID, we usually do the Thunder games and do the high five tunnel, and that just gave our kids an opportunity to meet the Thunder players, and then we kind of all sit together and join in and on the Thunder fun. So those are just some of the social opportunities together. We do a holiday party. This year it looks a little different. We're doing Holiday in a Box, but we're actually having Santa come to our office, and we're scheduling times to meet with him, and then everybody will get a craft and activity box to take home for the holidays. We offer quarterly workshops for our teen and adults. Heather mentioned a lot about, being the self-advocate they want to be. We've had these on public speaking, building resumes, safety and security. I'll tell you one workshop that was very eye-opening to me. Well, there was two parts to it. One, we did a session on self-defense, and we had the Oklahoma City Police come in and teach our kids kind of social awareness and some self-defense moves. But our kids are very apt in social media, and all of them are on social media. And so it was very telling how all of them wanted to friend everybody that asked for a friend request. And so it was great to, educate them like, no, if you don't know them, don't accept their friend request. And again, they thought everybody wanted to be their friend. I should just friend them. So, we've kind of had to think outside the box and how technology can be great for our kids, but can also be very scary, and how we need to keep up with those times to make sure that, they're safe on the internet. We also do, this is one of the programs we're extremely proud about. We offer free tutoring every Wednesday. It's actually happening now. Starts at 3 o'clock to 5:30. Karen Wallace, who's pictured there, is a special ed teacher who's retired now, and she offers those free services here in our office, and it's focusing on kind of the basics: math, reading, handwriting, spelling, and typing. We start those at age 3, and actually it can go through adulthood. So if any of our teen and adults need help with resume writing or writing a paper, they're more than welcome to come in. Karen actually modifies the curriculum to every age, every individual. And she also does IEP consultations for our families. And as of today, I think since the pandemic, she's done over 60 of those IEP consultations, and focus on virtual learning and therapies and rewriting those IEPs. That's, one of the things that many of our families don't know how to do, and don't know what to do, and don't know what to ask for. And I think that is really one of the areas where you all could really help us, and navigating and giving pointers. And, our families all go into those IEP meetings scared to death, and don't know, is this really what my kid needs? And just unsure of themselves. Some leave crying. I'm sure you all have heard stories. Karen has really been a godsend to us in helping those families kind of navigate that process, and, adding some different goals that are maintainable and not achievable to our kids. And like I mentioned earlier, she's even found where some students were, just given papers to do or classwork to do, and it's above their learning capability right now. So it'd be like giving a third grader algebra. Well, they're not going to know how to do it. It might take some of our kids a couple of years to get down those sight words before they can actually start putting the sight words together, for reading. And if it's too overwhelming for the child, they're going to not participate. That's where they're going to disengage, because they don't understand it. They don't know what they're supposed to do. And if you can't learn the basics, how can you learn algebra? So that's kind of where our tutoring center or learning lab has come into play. We hope to expand our learning lab, not offer just tutoring, but also we hope to build a sensory center here pretty soon in one of our rooms, where there's kind of lots of different sensory related gadgets, so to speak. And we'd like to work with therapists to come in and start offering free occupational and speech services. So the idea would be, bring your kid, at 3 o'clock, they're here for a couple of hours, and they're going to get all the therapy and academic tutoring they need, and then parents come back. So it also provides that respite time for our families as well.
Which parents desperately need right now.
Yeah, they do, especially ours. They're terrified.
Mm-hmm.
Another program we offer for our teen and adults is called Kylie's Kitchen. It's a microwave-based cooking class that we do every Friday night. We've actually started doing Kylie's Kitchen virtually, so we have kids participating online with us as well. And it just promotes, independent living and hands-on learning. There's a lot going on in the kitchen: organizational skills, math skills, cleaning skills as far as, how to keep things organized and clean properly. It's not just cooking things in a microwave, but you'd be surprised what all we cook in a microwave. We had turkey chili the other day with cornbread. We've made fudge brownies and chicken casseroles and all frittatas, all kinds of stuff. The kids love it. They get to keep the recipes, put them in a binder, and most of them go home and cook this for their family and make this a night for their families to share. And, it gives them a sense of pride that they get to cook for their mom and dad that night and siblings. This also kind of serves as a respite time as well. So we encourage parents to drop off at 6 o'clock and don't come back till 8. And the kids eat and cook together. And then usually there's some type of dance party or karaoke afterwards. Some proposals have also happened in Kylie's kitchen. Probably one of our main initiatives is that parent support groups. And we try to have parent meetings, at least once a month, or reaching out to our parents, through webinars and such, at least once a month. And we just listen to see whatever the topic of discussion is. I follow the Facebook page pretty regularly. And if there's a lot of discussion on IEPs, we might bring in an expert to talk about that. If there's, a lot of families talking about potty training, we'll try to do a session on that. So kind of whatever is at their height is what we're going to, offer for them. We've done parent groups on behaviors. So we did a behavior workshop last year. We've done them on puberty and what that means and what that looks like and how we as parents need to, prepare our kids for sexuality types of things. So, we kind of talk about everything from, beginning to end. We have a dads group, and that's just strictly our dads. It's called Dads Appreciating Down Syndrome, and they meet once a month. And, dads have different thoughts and need to talk about different things than moms do. But we actually started offering all of our parent support groups here at the office, just because we're kind of now centrally located and everybody can convene here. We do a lot of outreach. I try to speak to as many schools and medical professionals as I can, classrooms. We have board members that also are out there speaking on our behalf and talking, get the conversation starting about Down syndrome, just so people know who our kids are and what their capabilities are and not their disabilities. So we do as much as we can. I'm always open to any type of outreach that we can do to spread awareness and advocate for our kids. We have several camps. We're actually going to try to open another camp this summer, but we host a basketball camp for all ages and all abilities in the summertime. And then we have an occupational therapy camp, which we usually try to focus on self-care in those teenage years, because that's when they need to start, when puberty hits, and how do we handle all these things? I'm supposed to wear deodorant. I need to bathe regularly. Our kids just need to be reminded of that and have those visual cues. And we have a great relationship with Select Physical Therapy, and their occupational therapists, come in and do a session with this. This last time we did it on self-care, and it was hashtag selfie. So they took selfies themselves, they drew selfies of themselves, and it's kind of nice to see how they view themselves as well, and talk about what parts of your body do you like, do you not like. So we just want them to be very honest and open and transparent, so we can teach them the tools and the trades to move forward. So that's really kind of all the presentation that I had. I know there were a couple of questions in the agenda, and I kind of would like to address a couple of those.
Okay.
What services do we provide to schools and professionals? I'm willing to go to any of the schools or speak to any groups. Sorry, I know the phone's ringing. Talk about, what we do and who we serve. But most importantly, I think what we provide is support and resources. So if there's a book, or if there's a therapy, or if there's a webinar, or if there's information you need, or whatever it might be, just reach out to us if it's pertaining to a child with Down syndrome. And, we might not know the answer, but we might have a family that's been in this situation before and can help through that scenario. We've got connections. Our fingers go really far. We have a pretty far reach. as far as how can school staff engage with our organization, we have numerous volunteer opportunities. Kylie's Kitchen is one of them. I know we're right in the middle of a pandemic and it's kind of hard to do in-person stuff, but hopefully after we kind of get past this initiative, would love for you all to come in and do some talks. If you have a specific topic, like, gosh, I've seen this a lot in the school. Let me reach out to the Down Syndrome Association to see if Sarah could put together a parent meeting so I can talk to everybody about it. Those are the kind of things that we need to know, like what issues are you having so we can address that with our families, because they probably don't know.
Right. So like a special ed director of a district is able just to call you and let you know what maybe they need if they're having some issues, some help.
Absolutely. And we've actually had schools reach out to us, especially like, we have this child with Down syndrome and, we're not really sure what they're supposed to be doing and what academic level they're at. And it's like, well, what's the name of the kid? Who's the parents? And then we try to engage with the parents and just provide some information and of course, provide some facts to the school on, just treat them like any other child.
Right.
Likes and dislikes. What do they like to do? What are their motivators? All those kind of things. And I think some of that can get caught up in some miscommunication. We all get a little emotional when it comes to our kids. And, keep in mind, first of all, we didn't ask for this. We didn't plan for this. And we are learning as we go. But as mothers and parents, we always go with our gut and we're always going to think that way first. And we're always going to know our child best. So I think it's really important to build a relationship with the parents, especially setting that foundation in that first IEP meeting through that transition process in the beginning, just getting to know them, because I think that takes a lot of the edge off. I mean, I have great relationships with all of Kirsten's teachers and everybody that's been on her IEP team, and they know me really well. They know her very well. And we've just built those friendly relationships. I don't see this as a negative issue in her and them against her. It's us against them or anything like that. Like, let's just try to work together. What is the best process? And what tools do you have available? Okay, if you don't have those tools and my child needs an assistive device, where can we find them? I'll go out and research them. And that's one thing I can put you in that direction to. Here's who you can call about behaviors. Here's who you could call about waivered services. And I think it's just sometimes can be so overwhelming for our families still, even 14 years later, trying to figure out, okay, what do I do next? We're just living the day to day. In my experience, as far as what are the schools doing well and what are they not doing well in, I can only speak on the things I've heard from our families. And I really want to go back to the IEPs for a moment, because I really think that's where our families struggle the most. They don't understand the acronyms. They don't understand the goals and the language. You've really got to put it in layman's terms in really basic conversations. And I think if you just throw out the paperwork and just sit down and have a conversation and write down, what do you want your child to achieve this year? Are they reading? Are they doing sight words? Can they do alphabet? What kind of math are they doing? Parents are going to know, but when you put it in, different contexts and use different language, they're not going to understand it. And when you start throwing out acronyms and talking about different a program director here, or what is the child life specialist, they don't know what that means. So I think you really have to explain those terminologies to them. And, one of the things I appreciate off the bat is, I go in kind of with a profile, and we do encourage all of our families to do a one-pager, like, what does my child like? Where are they at? What health issues do they have? But, first and foremost, I kind of set the tone for the meetings, and I always say, here's what I expect of Kirsten this year, but here are some health issues she's been having, that might have a role in some of the, roadblocks that we could have. Okay, how do we get over that? But I think it just first starts off with building that relationship. And I would say that's probably what needs to be improved the most, because I think those meetings can be pretty, cold and starch. And, we don't like when families come in crying, like my IEP meeting was terrible. And, I've had families who've been suing districts because their kid can't, they've been somewhat abused in the system or whatever it might be. There's some pretty bad things that are happening out there. And, we just try to be as supportive as we can and point them in the right direction on, what to do next. That's not what we like to do, because we would like for everybody to have a great experience in the school system. And this, one of the things that's very frustrating for our families is, not being able to switch school districts. And if you live closer to one and the other, and, that's how the law is written, we can't change that right now. And so being accepted into a different school district or a school district outside of your district, that's where our families, sometimes hit some roadblocks and then don't know what to do. I think also they get a little confused when they are switching from Sooner Start in transitioning into the school system. They don't always know what that process is and what services are available. And, the service, they're available for all services. And then sometimes they're told, oh, well, we don't think your kid needs physical therapy. Well, so not a matter of think. Is my child running and walking and doing physical activities? Can they kick the ball like every other child? Probably not. Then we probably need to add some physical therapy in there. So I think just not saying no right off the bat and just kind of going through, hey, again, what is your child doing? What would you like for them to do? Where would you like to see them accomplish this year? Those are real important. And speech is another one. There's so many different things about speech therapy, and especially right now during the pandemic, everybody's like, how do you do speech therapy virtually? And how do you do occupational therapy virtually when you've got to do a lot of hands-on things? I don't have the answers for that right now. It is what it is. We're just going to have to, push through as much as we can. And of course, parents are getting the burden of a lot of the, virtual learning. And, keep in mind, a lot of our families still work and are trying to do that and do virtual learning with their child with special needs. And it can be a lot.
Right.
So I guess I'll open up, see if anybody has any questions after all of that.
You can either put your questions in the chat, or you can put them on the Jamboard, or you can just unmute yourself and ask away if there are any questions. And if there are no questions, that's okay too.
I wanted to also mention, there are actually 3 post-secondary education programs now for individuals with intellectual disabilities. OU has one, OSU is getting ready to implement one, NSU has one, and Chickasha has another one for autism. And we really, hopefully one day we'll be able to set up scholarship funds for our kids to go to college. That's kind of everybody's idea and dream. It is expensive. It is a certificate program only, that we'd like to see that change to where it's an actual degree, because I believe there are some of our individuals that can get a college degree and get a job and be successful doing whatever it is they want. So I think just always having an open mind about any child with any type of disability and knowing what their strengths are.
Very important. Well, I don't think there are any questions coming through. Kristen, do you see any?
There are none on the Jamboard. John Smithson did say that he really wants to thank you for this information.
Yeah, Sarah, thank you. Thank you so much you've answered all of the questions that we had on our agenda. So that was a lot of great information, and thank you for joining us and being willing to kick off our webinar series. We really appreciate it, and you guys do a lot of great things, and not everybody knows about you, so that's perfect. So
Well, thank you. I really appreciate it. I went ahead and put our email in the chat box in case anybody wants to email me some direct, I need this information, or do you have stuff on this? And then our website, which also has a link of our resources that are available. We try to video all of our webinars that we do and parent meetings. So they're all posted there for your review.
Okay, and also us at the State Department will also put out word when we get parent phone calls too.
Yes, please, please.
You're
And a
very
lot of our families don't know who we are yet, even in, in adulthood. So just send them
Right.
our way. It
Right.
doesn't matter what age they join us. We're happy to provide them with those resources and supports.
Okay, all right. Well, thank you so much.
Yeah,
Thank
thanks
you.
for having me.
Thank you, Sarah.
Yeah, you guys have a